Welcome to the Dental Water Cooler series, episode number 2, how your poor handovers are dramatically your cancellations, no-shows, and how to fix them once and for all. This is a very popular webinar, also a very popular training that I employ in my own business. It's a training that I bought the cornerstone of what causes cancellations and the flow-on effect from those. So just waiting for some attendees to join us here on the water cooler. I'd like to make the announcement that the water cooler series is sponsored by EKWA Equa Marketing, who provides SEO services and digital marketing services for dentists. Just want to make that there that this water cooler is a sponsored event by Equa Marketing, and you can Google search them if you're interested in their services. Also, just a declaration that, of course, I am a consultant dentist myself, or I am a dentist. I am a retired dentist, but I am a consultant, and you can see that behind me here, over here. Very popular Amazon book there, How to Build the Dental Practice of Your Dreams Without Killing Yourself in Less Than 60 Days. And also my Ultimate Patient Experience DVD and video series as well, and of course that's a financial interest that I have as well. So today we're talking about how your handovers again dramatically increase your cancellation. When you have poor hand, dramatically increases your cancellations. And people say, well, how can it be? How indeed can it be, David? Because I don't the connection. Most dental offices out there are operating on standby lists. They're operating on cancellations. Cancellation lists, people who've cancelled and not made new appointments, that's another list. Reactivation lists, patients who haven't come back for routine or regular examinations and hygiene visits as well. And the length of those lists is directly proportional to the quality of handover on in the dental practice. So if you're doing great handovers, what you'll find is that you have far less cancellations. Far less cancellations means far more work, means you're booked out further in advance. When you're booked in advance, people don't want to cancel their appointments then because they know it's going to take a long time to be seen again. And so people actually tend to keep their appointments. When the patients believe there is a scarcity in the appointments, they'll keep their appointments. And how do we create that scarcity? Well, we're going to talk about that today as people come on board. What we're going to talk about is creating that scarcity so that and why they have to have the appointment. They also understand why they need to keep the appointment, and they've got to understand what the condition is that is being treated. It's not an appointment. It's an appointment for the patient to have some pathology rectified. A lot of dentists soften it up and talk about what the patient's going to get, which is a filling or a crown or an extraction, but what we're actually doing is removing pathology, and you'll find that your patients will attend the practice much more frequently and keep their appointments if you emphasise that you're actually treating some illness. And dental decay is an illness, periodontal disease is an illness, having to have a tooth out, that is an unnatural act because the tooth has failed. So we've got to emphasise those points. So why is it important to do that? Because it is for the number one reason that when patients leave and create cancellations and create holes in your schedule, and you end up with a whole list of patients who have got appointments and yet they have outstanding treatment. That creates a void in the revenue for the practice, because all of a sudden that revenue that should have been collected because the treatment should have been done because the patient needed it, but didn't understand why, cancelled, rescheduled, delayed. When that patient delays, that affects the business cash flow. So again, that's a very bad situation to have, where you're moving patients who need one area of your practice to over here where they need treatment, but they're not scheduled and so they don't get the treatment. So you have this pile, this lengthy list of incomplete treatment that is indeed revenue for the practice as well. And we do know that dental conditions don't heal themselves. Decay doesn't go away by itself. Periodontal disease needs treatment. Worse, the things only get worse when they are not treated. They don't get better by themselves. So the important thing is that when we have a patient move over to reschedule, unscheduled list, we have to replace that patient with either another patient of the practice, or we have to replace them with a new patient as well. That puts a dramatic drain on resources, on manpower, on advertising dollars, on familiarisation processes within your practice. Every time you have to attract a new patient, you've got to get to know that patient. That takes time. Patients who trust you and have been coming for a while have created a relationship with those people, then we certainly have a better prospect of having them accept their dental treatment. Very, very important. So still waiting for people to come online. We've here, Eileen, thanks for coming online. Welcome to the Dental Water Cooler series. Just waiting for Eileen to appear on my screen here. But Eileen, we've been talking about the reasons why reducing cancellations in a dental practice is so important. My firm belief that the reason that we do need to the best way to reduce those cancellations is to look at the of the problem, and the core of the problem is poor handovers. Let me just see, I've got you on the list there. Seeing, yep, you're unmuted, so you're welcome to join. I don't have an image of you, and I don't have you coming up on. Oh, here we go. Better. So thanks for being here on the water cooler, Eileen. So let's get into the nuts and bolts of what we're actually trying to do here. To dramatically reduce the cancellations. Why is that the situation that we're trying to do? Okay, the reason is simply that the price and unprecedented number of pressures more than ever before. Absolutely, it is more difficult now than it has been in the past for a number of reasons. One of those is insurance companies. They're dictating the fees that dentists are paid. They're paying dentists less. That means there's an increase in net overhead for the dental practice. When the overhead goes up and the income goes down, because the overhead's here, is less. So to increase that margin, dentists need to cut their costs. And when they cut their costs, you end up with a decrease in the quality of care that is given to the patient, and also when your income goes down, decrease in your hourly rate. And so therefore the answer is, do I need to work harder? And the thought is, well, I need more new patients so I can do more work on more people at less fee to make the same money. And a ridiculous thing to be thinking that we actually need to do. Most dental practices that I see end up looking like a leaky bucket. And the reason for that is that there's no follow-up systems, there's no retention of, and so patients are in their practice confused as to what the next step is, and they don't make appointments, they don't schedule appointments, they make an excuse, don't know what I'm doing next week, got to talk to my husband about this treatment, and they don't get booked. And it is my belief that a patient who is clear on what they have to have done next, why they're having that work done, will make the appointment and keep the appointment. And it's the handover of the patient within the practice from the dentist to the dental assistant, and then the dental assistant to the front office person. And that handover process, when managed well, will result in the patient making the appointment, keeping the appointment, and actually even wanting to come in sooner for the appointment, purely because the patient understands exactly what's going on. Now, I've visited dental practices where the technology computers during the transfer of the patient, and they reduce the amount of patient and staff interaction. And when I say staff, I mean dentist, receptionist, dental assistant, and rely on the with patients being poorly informed and not making the appointments and not keeping the appointments. So they make the appointment and either cancel it or they don't return for the treatment. A gap in our book, we have to replace that person as well. So the leaky bucket, if you can plug those leaks, keep those patients, then you will have a much more successful practice. A lot of dental practices don't aim in the nuts and bolts of customer service. I've seen dental practices where there is absolutely no customer service training at all. In fact, more than half the dental offices that I've surveyed don't do any customer service training. And if they don't train on how to relate to people, then that's a big problem. Only 1% of dental practices that I've surveyed are in service skills and systems on a weekly basis. 2% are training on a monthly basis. 42% are doing it once a year, and 55% are never doing it. If staff don't have the customer service skills, that means that patients are not scheduling their appointments, patients are cancelling their appointments, and you patients that are calling your practice aren't even making appointments. And what happens is that dentists say, look, I just need more new patients. I've got gaps in my book. I just need more new patients. And they're leaking patients out through poor systems and poor customer service. They really need to. If they're doing the marketing, they're just not converting and keeping those patients. Very, very important. So let's look at the handovers that happen in the dental office. Now, remember with small children, telling the child once often doesn't sink in. Telling them twice, you've got a better chance. Telling them 3 times, an even better chance. If they hear it 3 times from 3 different people, there's far more one person, or if they hear it once from one person. So in my office, we developed a system where there were multiple people doing the handover, doing the same handover with the same information. What that means is if you can develop a system within your dental office where the same information is relayed to the patient multiple times by different people, then the patient will book, and there's more chance that they will grasp more of the information, understand more of the information because they've heard it from 3 different people and they've heard it 3 times, and they will then act on that information. But what I find is they hand themselves out the front office and they don't even talk to the patient during, so they just go out and they speak once to the patient at the front office and expect that the patient understands everything. And that's not the answer. And I don't understand why dentists are actually just isn't paid well to talk. When the dentist starts talking, they're replacing somebody else who could be talking and telling the same message who's on a lower hourly rate. And while that's happening, the dentist is drilling, but nobody else is stepping up to the drill. So it's a ridiculous scenario that dentists are actually doing handovers out at the front desk. So much danger having the dentist out there doing handovers at the front desk, because dentist gets caught, dentist starts running behind, dentist gets caught in conversation even, not just even a handover. It's a very inefficient use of the valuable time of the producer in the practice. So the system that we had relied on multiple people telling the same message, repeating that message during the patient's visit. So, when the patient left, there was total clarity as to what had to happen. So the handover happened in the treatment rooms. They also have it at the front office as well. There was also the dental hygiene room handover. So, Aileen, feel free to join in at any time if you'd like to type me to come on. You are unmuted, so you're welcome to join the conversation at any time. If you've got any questions directly, I'm those questions. So let's have a look at those handovers. Now, the important thing about the handover is that it's got to involve the patient. You can't just talk about actually involve the patient. It's got to be choreographed. It's got to be, patient's got to be positioned where we're getting agreement with them. Now, again, most dental offices tend to have an upstand area. If you've got a private office where patients can be treatment planned and appointment coordinated in a private setting, then this handover much better than the old style dental office where appointments and financials are sometimes handled at an upstand front desk. So you've got a barrier of an upstand, and then you've got a barrier of a computer monitor as well. And you've also got one person sitting down and another person standing, which creates an inequality in terms of conversation. The person standing will have more power. If we get, then we'll have some reciprocity. So the way that we did it in my dental office was that we had a private room. It was a glass-in room, so it wasn't like a dark interrogation room. And was brought out, sat on one side of the desk. The dental front office employee sat on the other side of the desk. So I was sitting across from each other. The dental assistant came into the room. Door was usually open. Glass door anyway. The dental assistant would stand on the side that the patient was sitting, so that the dental assistant could face the front office employee. The front office employee could look at the dental assistant, look at the patient for confirmation. And again, as I said, it was conversational. It was factual, but it was personal. So it wasn't like stand over there in the corner, Mrs. Patient, and wait until I've passed off the information. No, it was about involving the patient. So what would happen is the dental assistant would go through the appointment and what had happened, what was needed, and the receptionist, the front office person, would look to the dental assistant, acknowledge the information, look to the patient. Patient would be, yes, I understand, that's what I've had. Agreement, yes, that's what I've had. Agreement, I understand what I have to have done next. And where these people are in this process is very, very important. If you've got a situation where a patient comes out and they stand upstand and the dental assistant stands on the other side with the receptionist, then the receptionist has to turn away from the patient and back to the patient. And so again, you lose that eye contact. What you want is the dental receptionist having eye with both the patient and also with the the dental assistant as well. It's very important that it is choreographed so that people know where they've got to stand and how it's got to be. It's a process of introduction and handover. It's always talking, as I said, with the patient, involving the patient. And it's really important that people take their time in this process. Often the dental assistant is rushed. Sometimes the dentist is rushed. If the dentist is going out and doing it, and it's not it's not an ideal situation. Guess what happens when the process is rushed? We have failure. We have patients who don't get the full message, patients who don't understand the full message, patients who don't schedule more. It's absolutely ridiculous that for those few extra minutes of taking your time, making sure that the patient clearly understands what's got to go on, we end up with a patient committed to getting the work done, a patient in their mind committed because they understand what will happen if they don't get it done, and they understand getting things done. And it's really, really important that we cover those things. But including the patient in the process of the handover is very, very important because that increases case acceptance dramatically. Really does. And so I've seen dental offices. I remember going to a specialist office once, prosthodontic practice. Patient got brought out by the dental assistant, said, we need to do a crown upper right. And then the patient was left there. And the dental receptionist said, I'll just wait for that information to come up on the computer. And so what happens during that waiting time? Yeah, it's either stony silence or it's talk about something else, which is a distraction from the purpose of scheduling an appointment for treatment that the patient needs to understand. Every time you go off topic, away from the purpose of the handover, you distract the patient and you have to mentally bring them back into the conversation. That handover needs to be specific, step by step, and it needs to be consistent. Social discussion can happen after the handover, after the appointment's made, after at the time that we're making it. So the language would be at this handover something like this. The dental assistant would be bringing a patient out who had had some treatment, and she would say, today for Mrs. Smith, Dr. Moffat removed active decay on 3 teeth. The upper right first premolar, second premolar, and the upper right first molar. Now, she used numbers on descriptions because Americans use a numbering system, and I've got Australians and Europeans who use another numbering system, so don't want to confuse people. But the language is Dr. Moffat's removed active decay. So he hasn't done. That's not the patient's agenda. We want to have, what's the agenda? We've got that active decay out of the tooth. Dr. Moffat's removed active decay on these teeth. They were very large composite resin fillings. Now, 2 of those, the 2 premolars, were quite deep and getting down near the nerve, down the nerve. And Dr. Moffat warned Mrs. Smith about this damage and that there could possibly be nerve damage from that decay and the drilling to remove that decay. And the tooth behind the tooth, underneath that decay and that filling that was removed, there was a crack, a significant crack, and Dr. Moffat showed Mrs. Smith an image of that crack, explained that the crack would spread because the tooth now needs full coverage to protect the crack, stop it from spreading. So Dr. Moffat talked to Mrs. Smith about getting a crown. Mrs. Smith understands what a crown is. Mrs. Smith understands roughly, what our fee is for doing the crown, and she's keen to save that tooth. She doesn't want to lose that tooth. So we're talking in language that the patient understands. We're not using, he did an MOD on this tooth and an MOD on that tooth, and we need to do a VMK or a PJC, or, we're talking in language that the patient understands. Active decay, did some fillings, need to talk in that sort of language. It's always conversational, as I said, but it's factual, so that the dental receptionist understands what's going on. The patient also understands what's going on as well, and always speaking about the patient by using their name. Miss Smith, Mrs. Smith, today Mrs. Smith had. It's very polite to use people's names. It's very impolite not to use their names. It's really, really important to make sure that over and the patient has clarity as to what's going on. So let's run through those 10 essential components of the perfect dental handover, and clinical components, 5 non-clinical components, in that order. 5 clinical, 5 non-clinical. Very, very important. Excuse me. I have an itchy nose. Let's talk about those 5 clinical components, because again, a patient with clarity makes appointments, keeps appointments, and wants to come in sooner. Patient with a lack of clarity schedules or cancels or schedules and doesn't show up because they have that lack of clarity. So what are the things that we need to ensure that we have great clarity? Okay, very, very simply, the first thing that we need to do to make sure that we have the right environment. So when the dentist is doing the handover, excuse me, very itchy. When the dentist is doing the handover, the dental assistant is totally in attention. She's not creating noise. So the reason that handovers fail is, as I said, the dentist's in a hurry or the dental assistant's in a hurry. One of those reasons is that, and this doesn't happen so much in the US, but in Australia, to work out of one chair, one room, just over and over and over, same patient going in. And so the feeling at the end of the appointment is kind of like the feeling after you've ridden a roller coaster at an amusement park. Get out of it really quick because somebody else is getting into the carriage, and then off the thing goes. And that's not great customer service, but it also doesn't allow for great handovers, because part of the handover process, remember what I said, is that we want the patient to be feeling being dealt with by multiple people, all with the same message. Because the more that the patient information sinks in, hear it once from one person, not going to get the same result as if they hear it 3 times from 3 different people, or maybe even 5 times, 5, count them 5 from 3. How do you get it 5 times? David, how do we do it 5 times? Everybody's going to be talking, nobody's going to be drilling. Very simple. During the dental appointment, the dentist keeps the patient abreast of what's needed, what's being done. So that's the first time the patient hears it, during the dental appointment. Information is at that dental handover, and it's very important that it's framed up properly. I used to work out of 2 rooms. I had one patient in one room, and when I was completed with that patient, I would leave the patient in that room with the dental assistant, walk into the next room where another patient and another dental assistant were ready for me. So I was always treating a patient. I had no downtime for tear down to set up time. It meant that I was very, very time efficient and profitable. See, the patient departing back in the first room doesn't have to leave the room when I leave the room, because they've been handed over to the dental assistant. So if you can work out of alternate rooms, so it's not like back and forth roller skating, it's just like finish here, go here, finish here, go back here. It's very, very important to give it in I'd much rather work out of one room and have another dentist working out another room, and the hourly rate of that will be more, of those two rooms will be more than if I'm working out of one. Well, I say good luck, because after I sold my dental office and finished up working there, I did do a little bit of work at a couple of friends' offices, working out of one room, and I couldn't even get my hourly rate up to half 2 rooms. So, it just slowed me down, all that stop, start, and waiting. And it didn't really give great customer service. Patients don't like to come in and feel like their room has that. They'd much rather walk into a clean room. It's like booking into a hotel. Don't you like it when you walk into your hotel room? It looks like it's been ready and waiting for you all day. It's in pristine condition, but it doesn't look like somebody's just left that room. When you in the morning, when you're in a rush and you rush into the bathroom and got a warm toilet seat, you get that feeling, oh, somebody else has been sitting on this toilet seat. It's kind of like, now I know, it's not, it's like a warm chair on a bus or a warm chair on a train. It's kind of like, oh, somebody's been here. So using alternate rooms actually creates a better relationship. The other thing is that reusing the same room, dental assistants trying to put stuff away, trying to set stuff up, that's creating noise. Handpieces being clicked off, instruments being transferred from one side to another, all very noisy, very distracting for and the dentist trying to give the patient information, patient trying to receive information and hear it, can't do it because the noise going around. So let's cover those 10 points really here. The dentist will always be the one who initiates the chair coming up. That's really important. And when they bring the chair up, that's the time that the dental assistant then gets ready to greet the patient when they get back up to the vertical, greet them with a tissue, a warm towel, holding the cup out for them, just helping and assisting the patient. Very important that the patient feels that when they come up to the vertical, that they do indeed have the dental assistant assumes an attendancy role or an attendance role. And once the chair comes up, then the dentist comes around the front and looks a patient in the eye, face to face. So the dental assistant can be behind the chair, and she's taking notes. So she's part of it in that she's hearing and receiving information. But what she's got to do is she's got to hear all the information that she needs to hand over out front. So it's important that she knows what she's got to hear. And if she doesn't hear it, she has the absolute right to ask the doctor in a subtle way, in an appropriate way, for the answer to something that they may have skipped or inadvertently let go by without adding it. And sometimes that happens. Sometimes as dentists, we're totally focused on catching up time and we forget that we might miss one key step, one of those 10 key steps in the perfect handover. So what indeed should happen? First thing is that the dentist has to let the patient know exactly what treatment that the patient received. And the first important step is that the dentist must let the patient know exactly what treatment they had received today. Dentist has to say how many fillings they did, how many surfaces were done, how deep those fillings were, and if there was the schedule of what was originally meant to be done, because again, patients sometimes get out the front and they go, really? I thought these fillings were meant to be this fee and now they're a bigger fee. How did that happen? So it's the dentist's duty to let the patient know exactly what was done today. So today, Mr. Smith, we did 3 fillings for you. One of those fillings was larger than what we had expected before we went on to another surface. So just letting you know, there was a slight change to the type of work that you're getting done today. And Mrs. Smith used to go, yeah, that's okay. You can't let me know that all the time. The next thing the dentist needs to let the patient know is exactly what they're going to experience following the dental appointment. Because again, sometimes a patient comes in for something that hasn't been causing them any discomfort. The trauma of drilling and that removing the decay and restoring the tooth creates a post-operative discomfort. So if you can imagine, if you're getting a skin cancer removed from your hand, it doesn't really feel sore, but when they cut the thing out and stitch it back together, the wound hurts. So that's the analogy that you want to use, where we're traumatizing your tooth to remove that decay, a large drill spinning very fast. And there's the possibility that some experience post-operative pains and pain afterwards. And I used to talk in percentages. I'd say sometimes 20% of people experience some discomfort afterwards. Might be just a little bit of cold sensitivity, usually passes, and it's usually gone in 1 or 2 weeks, occasionally up to 3 weeks. So I go, oh, okay, understand. So then when they do get some discomfort or a feeling afterwards, the next day they say, oh yeah, the doctor said that would be it. So you don't want people to ring up, as I said, saying, tooth wasn't hurting before, now it's hurting. What's he done wrong? So exactly what treatment was done today, exactly, let them know exactly what they're going to feel following this treatment. Point number three is let the patient know exactly what treatment they'll be having done at their next visit to the office. This is the dentist's responsibility. It's not for the patient or the front office receptionist or the dental assistant. The dentist needs to know what he's doing in which sequential order so that he can clearly inform the patient. Mrs. Smith, next time you come in, we're going up to the top left, and we're going to be we're going to tooth with the crack, and going to be putting a crown on that tooth because the crack is quite significant and I don't want it to spread. So in telling the patient what I'm going to do, the patient know which tooth, what the condition is, and the severity of that condition. Clarity. And I'm saying this to the patient face to face, and behind the patient, the dental assistants making notes and writing. Next thing after that is the dentist needs to let the patient know the time frame or the urgency for the next treatment. So the dentist has to be very clued up as to what's available in there. Saying, I need to see you as soon as possible, Mrs. Smith, and dentist is booked 2 months in advance. Mrs. Smith's not going to be very happy. She gets out the front and says, he said he wants to see me in as soon as possible, and you say this where his book is at. So I usually used to say, I want to be doing that tooth. I want to be fixing that tooth next week. And let me tell you this, if something comes up sooner, I'd like to get you in. I'll be calling you to bring that appointment forward because I'm really concerned about that tooth. Is that okay? So it's dentist's role, the urgency. So suggest when you want to see them. Suggest that if something changes, you want to see them sooner. Don't say, I'm going to put you on a list. Say to the patient that I'm going to be calling you if there's a change in my book. So the patient thinks that they're the only person who's going to have access to any change in the schedule. Very, very important. The fifth and final thing that the dentist needs to let the patient know exactly what will happen if the treatment's not done when it's meant to be done. If the dentist doesn't tell the patient by someone non-clinical telling the patient, now, if you don't get that tooth fixed, the decay's going to get in the nerve, you're going to need a root canal, and then you're going to need a root canal and a build-up. Whereas if we do the crown now, you're not going to need the root. The authority is not there from a dental assistant or from a dental receptionist. It's very, very important that the dentist creates that significant reason of why treatment is essential. What will happen if the treatment doesn't get done? So if you don't get that decay removed next week, Mrs. Smith, and you leave it a couple of months, it's going to get bigger, it's going to get down near the nerve, and if that's the case, might have to do a root canal. If the root canal doesn't work, then I may be going to have to extract the tooth. And if the root breaks, I might have to cut your gum open, drill tooth out. Then the hole in your jawbone, I'm going to have to put some cow bone in there. If I put the cow bone in there, it's going to have to heal for 4 months, stitch it up, and then I'll get a big tungsten drill a hole in the jawbone, and screw a bolt down into that hole. Then I'm going to put a crown on the screwed bolt. That's going to cost you a lot more. It's going to be a lot more painful if we just put a crown straight over this tooth now, in the next few days, next week. So creating this disparity between what patient thinks can be put off until the next day, so to speak, and you letting them know if you put it off, it's going to be worse. Really, really important. So what are those 5 things? Remember, 5 things. Number 1, got to let the patient know exactly what treatment was done today. Number 2, let the patient know what they're going to feel between now and the next time they come in, so that they understand, because I don't have them calling up and saying, yeah, my tooth hurt. They understand. We can call them and say, yeah, get some deep feelings, just talk them off, just want to meet as to how you're feeling. We can do that, but that's our agenda, not theirs. The third thing is it's the dentist's responsibility to let the patient know exactly what treatment they're going to do next time. Fourth thing is of when that treatment needs to be done. Fifth and final thing is what will happen if it doesn't get done. And the dental assistant has the absolute right during that handover to her to ask the dentist if the dentist forgets to do one of those steps. When do you want to see Mrs. Smith? And would you like her to come in sooner if there's something else comes up between now and then? Dr. Moffat, what will happen if Mrs. Smith doesn't get this done straight away? We want everybody steering to that end result, that the patient leaves with all the information, understanding that treatment is imperative and the sooner the better. That's what needs to be done. First 5 steps of the handover. And only take a very short amount of time. Number six, look the patient in the eye, thank them sincerely for their time. Thanks for coming in today, Mrs. Smith. Appreciate seeing you. Really enjoy seeing you, Mrs. Smith. Thanks for coming in today. Thanks for coming in today, Mrs. Smith. Point number 7 is to thank them for being a great patient. You are really one of my favourite patients. Open and still for so long. I certainly can't do that when I'm at the dentist. You have a real talent. It's a pleasure being your dentist. Really important that you thank them for being a great patient for the day. Everybody loves recognition. You know, babies cry for it and grown men die for it. So hand the recognition out. Let them know that they were a great patient. Then thirdly, or number 8, wishes of best wishes and good health. Look after yourself, Mrs. Smith. You know, make sure that you rest up on that knee. Make sure that that tennis elbow gets better. Make sure that that sore neck gets some treatment. Just talk to them about their health. Wish them something personal about them. Keep your eyes on them. Remember, we want to keep the patient as well as possible. So wish them good health. Most dentists do. They're just on the computer, and the patient sometimes walks out and doesn't even hear a goodbye. We don't want to be like that. Number 9, recognise or re-recognise any significant event that's going to happen between now and when the patient comes in next. The patient's going away on a trip, the patient's going to attend a graduation, attend a sporting event, attend a theatre, go to the movies, purchase something. You want to make sure that you recognise or re-recognise any significant event. And then lastly, you want to be looking for creating an above and beyond experience for that patient. What can you do that's going to make that patient feel, wow, how did they know that? I can't believe they're still doing that. Can't believe, we want to create that above and beyond opportunity where the patient goes, wow, these guys, this didn't happen just by accident. These guys know that if this happens, this happens. And so those are those 10, count them, 10 things. What do we do today? What's the patient going to feel? What are we going to do next time? What's the time frame to doing the next visit? What will happen if we don't get it done? They're the 5. The next 5 is thank the patient for their time, congratulate them on being a great patient, wish them well, connect with them about some future event, look for above and beyond opportunities. So those are the 10 during the dental handover. Very, very important. And if you discuss that, the patient gets out to the front of your office, understanding what they're getting done next time, when they have to get it done, and what will happen if they don't get it done. And guess what that patient does? They make the appointment, they keep the appointment, and they want to come in sooner. And when we focus on those 10 things and we make sure that they're happening, because the front office person's got the exact same right to ask the dental the information they need to secure that next appointment. And that's all that's needed. Now, a good handover like that probably takes 3 minutes, max. 3 minutes. What I did today, this is what you're going to feel. This is what I'm going to do next time. This is the time frame when I want to see you back. And if you don't get it done in that time, this is what's going to happen. So we want to make sure that the patient has that clear understanding. So we move then from the clinical to do the touchy-feely stuff that separates your office from other offices, because the other offices don't do the touchy-feely stuff. The patients just walk out and go, oh, what'd you have done? Oh, you look numb. You look terrible. We don't want to do that at all. Often in my office, because we had these private offices for farewelling the patient, what that meant was that sometimes, if I had to go out to the front office while I was treating the next patient, the previous patient from half an hour ago is still there. So we get the appointment scheduled, we then get the financials done, and then it's time for the social chat. And the social chat can last forever. We used to have an outdoor area. A lot of dentistry was confirmed out there because of the relationships that were built. Very, very important. So it's been really good having everybody on the program for this webinar today. Our next webinar will be on the month, which will be December. Just let me check that date. I've got it here in my diary here, paper diary. Always love the feel diary. And that will be Tuesday. It'll be Tuesday the 11th of December. That's when that one will be on at 8 p.m. Eastern time. And just looking over here now for the title of that webinar, what our topic is for that webinar. Got the image here. Excuse me 1 second while I bring that one up. Where did it go? Sorry, some of these images are slow to load. Here we go. But if you're on the email list, you'll get that. Don't quite have it handy here in front of me at this point in time. Also, if you've got any feedback, please go to the website www.dentalwatercooler.com/dr dash Moffat, MOFFET -feedback/. So it's dental water cooler, all one word, .com/dr/ or dash Moffat, MOFFET -feedback/ So just letting you know, therefore, feedback. And just reminding you too that we need to thank Equa Marketing for sponsoring this water cooler series. Very, very pleased to have them on board. Really important to have them on board. So I know you're going to get a lot of, there's a lot of information to digest. Those of you that are on the call, welcome to call me. Welcome to email me if you've got any questions. david@upe.com, and happy to answer those if you want to know, dig deeper into the structure of the ultimate handover and creating that great handover that reduces emissions. Very, very important to do everything that you can to manage the handover, ensure that the patient makes the appointment, keeps the appointment, understands what they need to get done so that they actually want to come back sooner rather than later. I'm going to pause the recording now, and thanks, and I'll see you next month in December. Thanks for joining me on the Dental Water Cooler series. David Moffat, signing off. Thank you.